Hello, my name is Mary Keeler, and on this date of 9/2/2023, I am making a video that explains how teamwork, efficiency, and communication work hand in hand with quality of care and patient outcomes. Um, the purpose of this video is to explain how communication, efficiency, and teamwork apply to patient care and outcomes. Um, why are teams a valuable point of focus when considering quality improvement in healthcare? Teams are so important, especially in healthcare, because when we work and collaborate with each other, it can improve patient outcomes and can prevent confusing or errors that could cost patients their lives. Working as a team in healthcare is so important because there is so much to keep track of and on top of caring for patients, which can be hard. But that is teamwork and collaboration. But that is why teamwork and collaboration is so important to make the hard work seem easier. What distinguishes a team as high performing within a healthcare environment? Um, there are actually a few things that I would say distinguish as high performing in healthcare, but the two most important things I believe are you that you would need for distinguishing are trust and respect. If a physician does not feel trusted or respected, um, more than likely they can fail at their job because they don't want to try hard enough because they are not trusted or respected. Um, it's kind of like building blocks. We have trust and respect. Uh, we have to trust and respect our doctors and nurses. Then they will more than likely give the best patient care that is deserved. Truth and respect can very much determine a patient's outcome. Patient outcomes are so important um, in hospitals and medical facilities. Um, they rate the doctors by their patient outcomes, bad outcomes, and good outcomes. Um, how teams possess and the varying roles of individuals can impact quality assessments both positively and negatively. Consider elements such as leadership roles, individual responsibility, delegation, or task, decision making, ongoing training, education, etc. Every team has their own process, so not every team's going to be the same on how they do things. It honestly has everything to do with the dynamic and whether that group can work together or not. Um, they have to establish leadership, individual duties, task delegations, decision making, and continue the training and education as they go through their job. How does cross functionality of high performing team enhance its abilities to meet the quality improvement goals of healthcare organizations? How might having an interdisciplinary team potentially create conflict? How could these tensions be migrated to improve team effectiveness? One thing that one thing that improvement goals organization in healthcare is encouraging is effective communication across teams. Without that effective communication across those teams, things get jumbled up. Patient errors happen, paperwork errors happen, patient outcomes drop from good to bad. Um, when we bring people in with different perspectives, it can help with improving the problem solving and will lead to smarter decision making in the healthcare industry. So, if we were to bring an outsider in as a mediator, basically, um, to listen to the dynamic of that team, then they can sit there and be like, okay, this, and this needs to change, or this, and this is good, but let's tweak it a little bit so that communication stays fair and on point. Um, so many different knowledges help. Different, um, I guess you could say, everybody has their own knowledge on something, and it's good to have the different perspectives because it helps kind of minimize down to the one perspective that matters the most. If we look at all the facts and the research, you can clearly see that interdisciplinary is unequal in many ways. They both have different knowledge and have different types of experiences. The tension can affect the communication and the team dynamic. So you really have to know exactly how to work that in correctly so that it doesn't affect the dynamic of the group, doesn't cause more problems. This can also cause friction between everyone to where nothing gets done and the time frame of where it should be done is not there. It also, I mean, it also affects patient outcomes because if you're sitting in a group and these doctors and physicians and nurses are talking and there's different dynamics and there's interdisciplinary, um, it could cloud some people's judgment. It could cloud their way of thinking, and then things start getting mixed up. People start getting frustrated. Things don't happen the way they're supposed to. People get mad. They want to leave meetings early or just not come to them. How do elements such as conflict and change affect the dynamics of the team and its ability to reach a unified goal? And what a unified goal is one goal that helps everybody: patients, nurses, doctors, everybody. When we are talking about the dynamics of team and certain elements that come with it, such as conflict and change, we are referring to the discord caused between the anonymity and individual. Conflicts have a huge tendency to cause a distraction within a team dynamic. So, if there's a conflict in your team meeting, um, it's best to resolve said conflict first before making a decision on what has to be done, because if that conflict is not resolved, then it causes tension, it causes distraction, it causes things not to get done on a timely manner. These distractions can cause issues and to not be resolved in a timely manner. That's very important. When you work at healthcare, everything has to be done correctly and on time so that patients aren't affected and the physicians and nurses and all the other people who work there are not affected as well. And the whole industry, our facility, comes crumbling down. Um, the resources and types of support available that might enhance a team's efforts for continued quality improvement. Consider how components such as team culture, support, communication, and rewards may come into play. When we talk about patient care and safety, we have to look at what kind of facility we are running. What do we want this facility to be in the future? Communication within teamwork is so important because without good communication, the staff cannot work efficiently. Teamwork is so important. We have to work together to get things done in an efficient time frame. Having a lack of healthy communication between hospital staff can cause issues do not be resolved. By coming together and hashing out everything and collaborating together will bring up patient outcomes, prevent medical errors, improve efficiency, and increase patient satisfaction. And that's very important. Our patients, as healthcare workers, are the most important things. It's our it's our job to save their lives. It's our job to give them peace of mind. It's our job to be there for them when no one else can be. Thank you for watching my video.